Well, of course, we've got the biggest public health challenge of many of our lifetimes at the moment with COVID, and that's shown the need in order to get new treatments for COVID, but also for other infectious diseases and chronic diseases, get those new treatments to patients in the countries as soon as possible, but with appropriate oversight of safety, quality and efficacy. And so it's really required regulators to be agile and seek out new approaches. Can they work together as a collective? Can they work with a bigger, well-established partner, such as us in Australia or partners in other larger, better resourced, longer developed regulators, so that they don't have to do the whole assessment from end to end, because the whole assessment from end to end takes a large team of people and often many months, up to a year of work. And so new models of regulatory cooperation and agility can actually achieve this. So the Regional Vaccine Advisory Group has been established by ADB. I have the honour of having been asked to chair it. It involves the heads of regulators throughout the region, major countries as well as smaller countries. It also involves a number of key public health organisations, and its role is really to look at the landscape of vaccines, not only the ones that are widely used and are now household names, but also emerging vaccines that have been developed in the region and also outside the region. And that will feed into ADB decisions on potential procurement of different vaccines. It also has a role in looking at safety issues as they emerge from various vaccines. So it's a high-level grouping of the major countries in the region, and in that way it's unique. Well, I think the biggest two lessons are firstly that regulators can't operate in isolation. We are an important component of public health, but we've got to work together with, not be subservient, but be partners to our health departments and public health officials and public health agencies in the region. And that's always been important for communicable diseases, but it's especially become important and at the surface for the response to COVID. The second main message is that we can't do things alone. And whether it's working together with the biggest regulators, such as the FDA and the European Medicines Agency, or whether it's smaller countries working together as well, the importance of partnerships and sharing evaluations and working together is really how we're going to manage our limited resources in tackling the great challenge the world has of COVID.